Good afternoon, everyone. So, I love meeting you all regularly on this Facebook live sessions, and I'm really happy that you are enjoying this. And I get a lot of inquiries also on my Facebook as well as on my WhatsApp status regarding these sessions. This is a small way of trying to discuss something which we normally don't discuss, and that is health. We discuss a lot of things, but we never discuss health. I am Dr. Nirav Bhalani, interventional cardiologist and director at Rhythm Group of Hospitals in Baroda, Dahod, and Baswada. So today we are going to discuss what are healthy heart habits. And for that, first of all, why is it important? Because according to the WHO, World Health Organization estimate, the incidence of heart and heart diseases is growing phenomenally. A lot of factors have been identified which are new, particularly stress and type A personality, which was not there 30 years back. A lot of factors have been identified, and now heart and heart diseases are breaking the old norms, wherein it was understood that heart and heart diseases can happen only in the elderly people. It does not happen commonly in women, but no. Nowadays, we have younger people having heart attacks. I have a patient of 24-year-old who has a heart attack. Females, till they were menstruating, they were protected, but nowadays we find young females developing cardiac problems. It is gradually becoming the number one killer. And apart from killing, it is important, it is more responsible for morbidity. That is, the life of the patient is lifestyle, or the life is deteriorated. He cannot do day-to-day activities. He cannot be a part to normal activities like playing, climbing stairs, commuting. क्योंकि अगर हार्ट कमजोर है तो ये सब छोटी छोटी चीजें वो नहीं कर पाएगा. And when this affects the younger population, it affects the growth of the nation, because this is the workforce for the future and development of the nation. And इसीलिए WHO has put heart and heart diseases amongst the red flag signs, wherein in the developing countries, especially like us, wherein the developing countries, it is on an upscale, वो बढ़ता ही जा रहा है. So, coming to a small story, what is heart? Heart is a pump. It is a powerhouse, and it pumps more than 5 to 6 gallons of blood every minute. And जिस दिन से, the day we are born till the day we die, it pumps non-stop without having any breaks, no holiday, no Sunday, and it does not even ask for bonus. So God has created a wonderful powerhouse, and it is our responsibility to take care of that powerhouse. It is our responsibility that to see to it that it remains in a healthy situation. So whenever we talk about heart diseases, two important factors come into our thought, that is risk factor. So what are the risk factors? Whenever we talk about heart disease, the risk factors are bifurcated into modifiable and non-modifiable. So non-modifiable risk factors are age, sex, and family history. We cannot do anything about it. We are always going to grow old only. We cannot grow young, and therefore age is a non-modifiable risk factor. With more the age, more the chances of heart and heart diseases. Second is sex. Male, पुरुषों में ये ज्यादा होता है, फीमेल बहनों में ये कम होता है till the time they are menstruating. जब तक they are menstruating, the incidence of cardiac problem is less in female, but after menopause वो बढ़ने लगता है, और by the age of 60 years both male और female में ये incidence same हो जाता है. And the third is family history. If my father has a heart attack, or if my brother has a heart problem, my chances of developing a heart problem is more compared to my friends. तो ये तीन चीज अपने हाथ में नहीं है. But there are a lot of things which are there in our hands, which we can control. And if we control them, the future of developing a cardiac problem goes down dramatically. So, what are those modifiable risk factors? The modifiable risk factors would be blood pressure. तो अगर ब्लड प्रेशर अपने को है तो उसे अच्छे से कंट्रोल करना चाहिए, आइदर बाय डाइट, एक्सरसाइज, एंड इफ रिक्वायर्ड ड्रग्स. If you are on drugs, you should regularly monitor your blood pressure and be in touch with a good family physician. आपके जो भी family physician है उनके साथ संपर्क में रहना है. You should be very clear that उम्र के साथ ब्लड प्रेशर बढ़ता है, उम्र के साथ इतना ब्लड प्रेशर तो होता है, ये सब गलत फहमियां है. आपका ब्लड प्रेशर 140/90 140/90 से कम होना चाहिए on any given day, on any given time. So that is important. Second is diabetes. Diabetes is a modifiable risk factor. अगर मुझे डायबिटीज है तो फ्यूचर कार्डियक इवेंट के चांसेस बहुत बढ़ जाते हैं. And therefore, all diabetics should control their diabetes aggressively. Again, by diet, exercise, if required by drugs or insulin, and you should be in touch with your family physician or a diabetologist. हमारा फास्टिंग हमें 140 के नीचे, हमारा PP2PS हमें 180 के नीचे, और हमारा HbA1c यानी 3 महीने का एवरेज डायबिटीज का रीडिंग 7 से आजू बाजू चाहिए. सो कंट्रोल योर ब्लड प्रेशर, कंट्रोल योर डायबिटीज. कोलेस्ट्रॉल, इफ यू हैव कोलेस्ट्रॉल यू शुड कंट्रोल इट, बिकॉज कोलेस्ट्रॉल इज एसिम्प्टोमेटिक. अगर आपके ब्लड में कोलेस्ट्रॉल है तो उसकी वजह से अभी आपको कोई तकलीफ नहीं है, बट इफ यू डोंट ट्रीट इट और इफ यू डोंट कंट्रोल इट, 5, 6, 7, 10 years later, you may have developed cardiac problems, brain problems, or kidney problems, and therefore cholesterol should be controlled. तो इन तीन चीजों के लिए my thing would be कि at the age of 40, whenever you are 40, you should first do your health checkup at the age of 40. So on your 40th birthday, the wife should give husband a health checkup, and the husband should give wife a health checkup on their 40th birthday. And that the health checkup should be a routine health checkup. It should not be very detailed. It should include common risk factors like sugar, cholesterol, creatinine, ECG, some basic tests. And that basic test at the age of 40 should be a benchmark for the future years. And if you are diagnosed to have blood pressure, diabetes, or cholesterol, aggressively treat it. The other risk factors are smoking, tobacco, and alcohol. Believe you me, the younger generation is exposed to these habits more than what we were, and maybe probably more than what our grandparents were. It is easily accessible, number one. The media is showing that it is a style statement to drink, to smoke, and if you don't smoke, maybe you are not a Mac man. So the younger generation is under the influence that these things are normal. Again, they have the money power. At the age of 20, 21, people are doing part-time jobs. They are into BPOs. They have their own money. I don't remember when I was 20 whether I had my own money or not. I was always dependent on my pocket money given by my father to me. So the younger generation is smart. The younger generation has their own money. They are much smarter than what we were. And they are now easily getting tobacco, smoking, alcohol. And therefore, one reason why heart disease is common in younger population nowadays is because of smoking. Whenever a young patient develops a cardiac problem, the commonest cause would be smoking, and second common would be alcohol. So it is always better to keep a check. Ideally, you should not smoke or drink, but if at all you have a habit, if at all you want to do it for recreational purposes, you should keep a check. You should keep a check on the quantity of the nicotine that you are inhaling, on the quantity of the alcohol that you are taking. Third is stress and type A personality. This is the 21st century. We are a developing nation, and therefore, a lot of stress is there in the generation. Work stress, family stress, relationship stress, all this stress builds up, and stress can lead to a lot of lifestyle disorders, diabetes, hypertension, cardiac problems. These are all related to stress. So it is important to unwind yourself. It is important to understand that the world will go on. Even if Raj Kapoor is not there, Hindi film industry is doing good. So you have to unwind. You have to take out at least 15 to 20 minutes for yourself daily. You have to go for meditation, yoga. It can be done at home. You have to indulge into some things that gives you pleasure. It could be swimming, it could be singing, it could be music, it could be whatever you like. That should act as a stress busters. Again, our social life has become very complicated. I would have thousands of friends on the social media, but when I want to talk to someone, I don't have anyone. This is very common. So there is a joke also. कि अगर दिल खोला होता अपने दोस्तों के सामने तो नहीं खोलना पड़ता कार्डियक सर्जन के ओटी टेबल पे. Similarly, you need we are humans, we are highly evolved species, we need social interactions, and that with social media is a pseudo social interaction. So you should have couple of friends, couple of family members whom you can open up to, with whom you feel that you are, yes, you are genuinely unwinding. And how to tackle with stress is a individual for every individual it will be different, but we should consciously try to avoid stress. We should consciously try to do meditation, listen to music, indulge in some activities with our friends and family members wherein we forget about work pressures or other pressures. That is important. Third is obesity, motapa is coming up in a big way in the Indian population. Recently, we had a small pilot study wherein students of 12th standard of different schools, we had measured their BMI, and believe you me, it was sizable percentage of the students were overweight. This overweight students would eventually become hypertensive, diabetic, and have cardiac or neurological problems if they don't control it. Now, why are we overweight? Because we are not exercising. We are consuming a lot of calories. McDonald's, Pizza Hut, lot of calories because the younger generation, as I said, have easy access to money. They have their independent thoughts. So, lot of calories are being consumed, and we are not into exercise. We are not into regular gymming. We are not into regular jogging. So calories are coming up and building it in the body, and they are not being spent by regular exercises. So that is the reason why the younger population is obese, and these obese students, these obese young children, when they become adults, they would have lifestyle disorders. So it is, as a parent, it is our duty to see to it that they control their calorie intake, do their bit of exercise. We should encourage exercise and healthy living in them. So these are some of the risk factors, modifiable, non-modifiable, as I discussed. Right now, coming to how do you avoid them? So again, it boils down to three important things: diet, exercise, and if required, drugs. You should not shy away from drugs. If at all you have hypertension, you have diabetes, and your physician or your general practitioner, family doctor feels that you need to be on certain drugs, you should be. Why not? You cannot say कि नहीं नहीं ये तो गलत है, मुझे कुछ नहीं हो सकता है, मुझे अभी कुछ नहीं तो मैं दवाई क्यों लूं? अभी कुछ नहीं है, but in the next 4, 5, 6 years something may develop. So these are preventive medicines, right? So coming to physical activities, I would advocate at least 35 minutes of physical activity, minimum 5 to 6 days out of the 7 days in a week. 30 to 35 minutes of physical activity. It could be as simple, you don't need to be in a gym, you don't need to be under a trainer. It could be as simple as walking, cycling, jogging, swimming, whatever you like. You should be doing at least 35 minutes of physical activities daily. That is good enough for your cardio. More activity you do is more for your endurance, is for your stamina, is for your muscle building. But for cardio, 30-35 minutes out of the 7 days in a week, at least 5 to 6 days, it should be good enough. And walking, mind you, should be a bit brisk. It should be somewhat less than running, but somewhat definitely more than a casual walk. So, a brisk walk or a jog or a swim or a cycling are very good physical activities to do cardio. Regarding food and food habits, we should we should consume food which is less in calories, which is less oily. Food which are good, especially are flax seeds, akhrout, badam. Food which is good is olive also. Then what you should understand is that excess of fat should be avoided. If you are a non-vegetarian, you should look at the sea. Seafoods are good. Fish, it has omega-3 fatty acid. Compared to, let us say, mutton or chicken, seafoods are better in moderation. If you are a habit of having bread toast or something, brown bread, go to brown bread. Nuts are good. Badam, akhrout, pista. You should try and go down on cashews. Cashews should be less. Green leafy vegetables, salad. One small bowl of salad every day is very good. It gives you antioxidant. It decreases your appetite for your main meal. Also, it gives you energy. Similarly, fruits. All the fruits are good. Apple especially. If you are diabetic, you should try and avoid sweet fruits like banana, chiku, mango. A lot of questions do come during my talks about the type of oil. My first sentence is any oil should be used in moderation. You cannot have that this is the best oil and you can use more, double the quantity. No, so the quantity should be less. And then when you talk about different kind of oils, I would advocate sunflower or corn or rice bran over peanut oil or cottonseed oil. Again, exercise we talked about diet, we talked about the doctor's medicine. Something known as aspirin. Low dose aspirin can prevent future cardiac events. So if your doctor feels that you need to be on a low dose aspirin, then you should be on low dose aspirin. So I think this was a broad discussion about lifestyle and life disorders, cardiac disorder especially. So I would open up to questions if anyone has any. What happens is a broken heart syndrome is left untreated. Sorry, dear, I don't know what is broken heart syndrome. Do you? So if you can elaborate, I'll be able to guide. I have a family history of heart disease. Can regular physical activity and health diet help at all? If you have a family history of heart disease, then yes, you should be doing regular physical activity and healthy diet. Also, you should get yourself frequently checked because you have a non-modifiable risk factor as we discussed in our lecture. So chances of you developing cardiac problem would be more than any of your friend who does not have a positive heart history in the family. But knowing that if you are regular with your exercise, if you are eating healthy, and if you are regularly taking care of your blood parameters, you should be able to avoid or at least delay the cardiac risk progression. Yes, this is the commonest thing that I face with most of my patients, that I work very hard. I work in a corporate environment. I'm not able to find out time for exercise. Again, this is an excuse, dear. If you don't find for your time for your heart right now, when you age, your heart will see to it that you are in a hospital and you will have all the time for your heart only. So getting 15 to 20 minutes a day should not be a big problem. But still, yes, if you are in a corporate job and you don't have time, small changes like in your office, don't use lift, try to climb upstairs. In your office during the lunch hours, try to walk around. Or if majority of the corporates nowadays do have a small gym space, so you can do a treadmill during your lunch hours. So small changes in your lifestyle. For example, during Sundays, if you have garden, try gardening. So small lifestyle changes can be. It's not necessarily that you go to a gym and get out or take a time of 1 hour daily. You can do exercises anywhere, anytime. Simplest exercise, as I told you, would be climbing stairs. Don't use lifts. Secondly, how long should I exercise? Yes, the recommended is 30 to 35 minutes of cardio exercises at least 5 to 6 days out of the 7 days in a week. Passive smoking is bad. Definitely, passive smoking is bad, especially for the lungs. So, if your friend is smoking, you should tell him that whenever you smoke, you should be away from the company. You should smoke on the sides, or you should cover your face with a mask. Passive smoking is definitely bad. How would I know if my heart health and when should I consult a cardiologist? See, as I said, normally in the younger population, we don't expect anything significant. But if you have any symptoms of cardiac problems like breathlessness on exertion, चलने पे सांस फूलना, chest pain और सीना दर्द, तो आपको कंसल्ट करना है. Otherwise, at the age of 40, you should get your first routine health checkup done. And if you have a strong family history, maybe even earlier, and if your health checkup shows an abnormality, then you should meet a cardiologist. Anxiety doesn't weaken your heart, but anxiety stresses your heart. So whenever you are anxious, your heart rate goes up. Your body has your vessels have vasoconstriction. So all this affects the heart in the long term. It does not कि आज anxious हो और कल heart attack आ गया. No, but over a period of time, it can affect your heart, and therefore you should try and control your anxiety. You should try and control your depression. You should try and control your mental health, because a good mental health means a good cardiac health. I think I answered this. My heart tends to beat faster than regular people when I work out. Could this be a matter of concern? Two things. One, whenever you are starting your exercise program, your heart is not accustomed to this level of exercise, and therefore you will have some heart rate increase. Over a period of time, as your body starts acclimatizing, as your heart starts acclimatizing, with the same amount of exercise, your heart rate increase would be less. So one, it could be just exercise intolerance. That is, you're not exercised since long and now you're exercising, so your heart rate is high. But if you feel it is more, then definitely you should consult your doctor, and certain basic tests like hemoglobin, thyroid, and some and ECG. This can point out whether you have an abnormal reason for your fast heart rate. Otherwise, it can be simple exercise intolerance. Stress in teens again will not affect the heart immediately. These are indirect ways. Stress in teens can lead to excessive eating disorder, obesity. Stress in teens can lead to hypertension, and this in the long run may affect the heart. So, stress during any age is bad, and we should try to minimize it. Dark chocolate and caffeine definitely, but again in moderation. Caffeine in high doses can cause tachycardia. Caffeine in high doses can cause vasoconstriction, and therefore, in moderate doses, dark chocolate and caffeine are good for your heart. True. So I think, friends, thank you. With this, we wind up this session of Facebook Live. It was pleasure interacting with you all. And if you have any further questions, you can always put them on my Facebook. Thank you.